Next is urethral or bladder trauma. It's a v47. A 40-year-old male is admitted following a road traffic accident. He has multiple injuries, including rib fractures and a pelvic fracture, for which he has been placed in a pelvic binder. On examination, there is blood present at his urethral meatus, perineal bruising, and a palpable bladder. He states that he is unable to void. What do these features suggest? A likely posterior urethral injury. What is the significance of butterfly pattern perineal bruising? A butterfly pattern of bruising extends from the penis scrotum lateral to the pubis and posterior in the perineum. The significant urethral disruption during impact, and this fracture results in movement of the bone fragment in AP direction, causing urethral disruption. How will you manage him? One, gentle attempt at urethral catheter insertion as per trauma guidelines. If this fails, then the next step, patient should have a retrograde ureterogram if cells are available, or consideration of suprapubic catheter insertion. You manage to catheterize him ureterally with ease, and he has hematuria. Meanwhile, his subsequent trauma imaging confirms a high-grade splenic injury, following which he becomes unstable and you proceed to a trauma laparotomy. Intraoperatively, free fluid is found in the abdomen and bladder perforation identified. What are the surgical principles of bladder repair? The preferred method is two-layer vasectomy with absorbable sutures. It can also be closed in a single-layer continuous watertight fashion. Suprapubic and urethral catheter should remain in situ for 10 to 14 days, with drain placed in intrapubic space for 1 to 2 days. Intravenous antibiotics should also be commenced, and cystogram should be performed approximately 10 to 14 days later prior to removal of the bladder.